Hello and welcome back. This is Junhua from TCM Explained. In this video, we will be learning our first channel, the long channel of hand Taiyin. Let's start with the Cun Measurement System because it will guide us how the channels traverse the body. Base unit for this system is 1 Cun. This is the width of the interphalangeal joint of the thumb. The distance between the midpoint of the clavicles is 8 Cun. The distance between the sternocostal angle and the belly button is 8 Cun. The distance between the belly button and the pubic symphysis is 5 Cun. The distance between the anterior axillary crease and the cubital crease is 9 Cun. The distance between the cubital crease and the wrist crease is 12 Cun. The distance between the lateral prominence of the greater trochanter and the popliteal crease is 19 Cun. The distance between the eyebrow and the front hairline is 3 Cun. The distance between the front hairline and the back hairline is 12 Cun. The distance between the medial border of the scapulars is 6 Cun. The distance between the gluteal fold and the popliteal crease is 14 Cun. The distance between the popliteal crease and the lateral malleolus is 16 Cun. The distance between the popliteal crease and the medial malleolus is 15 Cun. Now let's move on to the primary channel of the lungs. The lung primary channel originates in the middle burner where the stomach is located. The channel goes down to connect with the large intestine, goes up again, passes the stomach and the diaphragm, and it penetrates the lungs. It further ascends to the throat and then emerges at the first acupuncture point of the channel, lung 1. It goes up to the center of the deltopectoral triangle, goes down along the anterior lateral aspect of the upper arm, and passes the cubital fossa of the elbow where lung 5 is. It continues to go down along the anterior lateral aspect of the forearm, passing lung 6. It goes to lung 7, passing the styloid process of the radius. It follows the lateral border of the radial artery, passing lung 8 and lung 9. Goes to the thinner eminence, passing lung 10, and terminates at the radial side of the thumbnail at the last acupuncture point of the channel, lung 11. The primary channel has one branch at lung 7 at the styloid process. This branch goes to the radial side of the tip of the index finger where it connects with the first acupuncture point of the large intestine channel, large intestine 1. The lung luo-connecting channel is relatively short. It separates at lung 7, follows the primary channel, spreading to the palm and thinner eminence, and then connects with the large intestine channel. The lung divergent channel diverges at the axilla, connects with the lungs, and disperses in the large intestine. There is a branch coming off from the lungs, goes up to the supraclavicular fossa, throat, and then connects with the large intestine channel. The lung sinew channel starts at lung 11. It binds at the thinner eminence, goes along the flexor aspect of the forearm, binds at the center of the elbow, goes along the anterior lateral aspect of the upper arm, and enters the chest below the axilla. It emerges in the supraclavicular region and goes laterally to the shoulder anterior to large intestine 15. From the supraclavicular region, it also goes down to the chest and spreads over the diaphragm and floating ribs. Here are the key points. The primary channel originates in the middle burner. The primary and divergent channels travel to the throat region. The primary and luo-connecting channels travel to the index finger to connect with the large intestine channel. The primary channel connects with the three organs, the stomach, large intestine, and lungs. The lungs are the lung primary channel's associated yin organ, and large intestine is the internally externally related yang organ. The stomach is the organ of the yang ming channel, as is the large intestine. The sinew channel starts from lung 11, unlike the primary channel. So that was the anatomy of the lung channel of hand Taiyin. In the last video, we learned that one of the functions of the channels is to respond to the dysfunction in the body. The channel can have problems due to stagnation of qi and blood from physical injuries or overuse. The channel can have problems due to invasions of exterior pathogenic factors such as wind or cold. The channels can have problems because of yin-yang imbalance or internal organ disharmony. Now let's look at what kind of signs and symptoms manifest when there is a problem with the lung primary channel. Shortness of breath, cough, wheezing, fullness and oppression of the chest. These are due to dysfunction of the lungs in respiration and descending of qi, leading to the counterflow of qi. Aversion to cold with sweating. This is due to dysfunction of the lungs in dispersing and diffusing. Frequent urination. This is due to dysfunction of the lungs in regulating the water passage. Pain in the throat, pain and coldness of the arm, shoulder, and chest. These are due to stagnation of qi and blood in the channel. Now let's look at the lung luo-connecting channel. In excess syndrome, there is a feeling of heat in the palms. In deficiency syndrome, there is a yawning, frequent urination, and shortness of breath. And the lung sinew channel shows signs and symptoms of pain and spasm of the muscles along the sinew channel. Since we are learning about the signs and symptoms of channels, let's go over some acupuncture points that can treat them as well. In general, any points on the lung channel can be used to treat the dysfunctions of the lungs. But every point has its own special actions. We'll learn about them in more detail in future, so for now, let's briefly go over some of the lung channel points. Lung qi deficiency can cause cough, wheezing, and fullness and oppression of the chest with shortness of breath, yawning, or copious watery phlegm. On the other hand, lung yin deficiency can cause cough, wheezing, and fullness and oppression of the chest with heat in the palms, spitting of blood, or scanty dry phlegm. Lung 9 is a major point that can tonify both lung qi and lung yin. In case of cough, wheezing, and fullness and oppression of the chest due to excess rather than deficiency, lung 1 or lung 8 is a better choice. Lung 5 can clear all kinds of heat from the lungs and descend the lung qi. Whether heat is caused by deficiency or excess, or internally or externally, lung 5 can be used. For acute conditions, lung 6 can be used, especially when there is a bleeding due to wind dryness or wind heat. Aversion to cold with sweating refers to the invasion of wind, causing common cold symptoms such as chills and fever, nasal discharge, and headache. Lung 7 is a major point that can release the exterior wind. Not only that, it can also clear the internal wind that causes headache. As wind attacks the upper part of the body, lung 7 is well known for treating the head and neck problems. Since the lungs are the upper source of water and they regulate the water passage, when the lungs are deficient, there may be frequent urination or inability to control urination. At this time, lung 5 can be used. On the other hand, when the exterior pathogenic wind obstructs the movement of water, there can be urinary retention, and for this case, lung 5 can be used as well. For pain in the throat, lung 10 or lung 11 can be used. Lung 10 can be used for both excess and deficiency heat, whereas lung 11 is used more often for excess heat. For pain and coldness of the arm and shoulder with restricted movement, lung 5 is an important point. Also, especially for the acute conditions, lung 6 is useful as well. For feeling of heat in the palms, lung 10 can be used as a local point. But since lung 10 also clears heat from the lung channel and the lungs, it is appropriate for this condition. and lung 7, 8, 9 are also indicated for heat in the palms. That's it for now. If you want to learn more about how we treat these signs and symptoms, please check our blog. The link is in the description. In the next video, we'll learn about the large intestine channel of Han Yang Ming.